My name is Samantha Gamble-Spar, and I'm a nurse practitioner intensivist, specializing in caring for those in surgical ICU, trauma ICU, neurocritical care ICU, or cardiothoracic ICU. I was actually born in San Diego at Balboa Hospital. My dad was in the Navy, and we moved away. And probably about 15 years ago, I moved back to San Diego County.
My name is Samantha Williams, and I am a recent graduate as a family nurse practitioner. I have over 10 years experience as a registered nurse. I have worked in the community care, home health. I've done wound care. Also worked on a cardiac unit. Currently, I serve as the co-chair for the San Diego Immunization Coalition, as well as the chair for the immunization chair for the San Diego Black Nurses, and those two roles really complement each other.
San Diego Black Nurses Association was affiliated in 1976, and it is an affiliate of the National Black Nurses Association. As such, we have worked in San Diego County to help decrease health disparities through education, advocacy, and health promotion. Our organization comprises of those from doctorally prepared nurses to LVNs, even those who were students, nurses, or community leaders and advocates in working to help our community in time of healthiness and even through this pandemic currently.
For all of us individually, we've had a lot of unprecedented situations that have arose in our lives. What was interesting to me that I don't think I will ever forget, that will definitely be a stamp for me in my lifetime, is really how the result of the pandemic will further deepen the gulf of health disparities among vulnerable communities, and just grasping how embedded systemic discrimination and racism against these certain communities, what that result will be in terms of a pandemic. And just how it's intertwined in every facet of our living.
As frontline workers, I'm sure that you can imagine that as nurses, physicians, respiratory therapists, we work together, and we really had to depend on each other, even more so now, as not only as we care for communities, but as we care for ourselves and our families as well. And so that is something that definitely is unprecedented at this moment in time as it relates to this COVID-19 pandemic.
SDBNA has partnered with several of our faith-based organizations, as well as community food distribution centers and other community partners and organizations. And we did this to ensure that our community had access to flu prevention. We ensured that we reached our most vulnerable populations, those with comorbidities, those with increased in age. And even though many of them were hesitant, just being able to provide the education and awareness, how essential it was to make sure that they did receive this level of access to care. It definitely opened up the door so that when the COVID vaccine has now come out, that relationship that has been there for many years, that we didn't want to drop that ball just because of the pandemic and what was going on, and that there be a gap in them seeing our faces and us providing these type of services to them. And that has been instrumental. And we have already had a lot of these same community organizations already reaching out, saying that we want you here. We want our community wants to receive the vaccine from you. And some of them have said from you and you only. So we have felt extremely honored to be able to provide that service.
We have been involved in several task forces from the very beginning, and have been collaborating with those to help come up and formulate plans as it relates to, number one, what are we going to do once the vaccination actually arrives? Since the vaccination has arrived, many of our members as frontline workers have been vaccinated themselves first and foremost, and we are now in preparation in coming up with ways for us to service our community in providing those vaccinations. 2020 was like the year of the nurse and the nurse midwife, which was very interesting because, healthcare providers had to it was a very interesting time last year, and it continues to be an interesting time. But particularly there in the beginning, it was so poignant that 2020 was the year of the nurse. I mean, and the nurse midwife. So it was kind of poignant as it relates to that. So, but we know that nurses have been the #1 trusted profession for 18 years now. So I think that it's important for us to remember that nurses contribute greatly to healthcare along the continuum of healthcare, and that they should be included in decisions as it relates to global healthcare.
Verify and trust.